So let me see. All right. Everybody, افسون شما میبینی که هر کس که بیاد تو درسته؟
I don't see them actually.
نه اگه تو waiting room باشن.
I can't still.
No, only Nazi. I think only you see.
Oh, really?
Yeah.
No, usually I become the co-host. برای همین چیزه.
I mean, somehow through this Eventbrite, it's a little bit different. So thank you everybody for coming. Awesome to have this afternoon, and thank you for spending the time with us.
Absolutely. So we have Mahbube. Hi, this is I'm Noushin. We have Nasrin, Ben, and Nahid. Please try to turn on your cameras so we can see your beautiful and handsome faces. There it is. Hello.
Wonderful. Thank you so much. So awesome to see you.
Oh, I don't know what I'm doing here, but I'm here.
You're the only man so far. We'll see.
Yeah, I don't know. I maybe I should leave also, but that's okay. Just move on.
The other man hasn't shown up, so we'll see.
We appreciate the support.
Sure.
And it's a good information since you have a wife and you have a daughter. So.
Nieces.
Yes. Thank you so much for joining us. Nasrijan, thank you so much for being here.
Yeah.
Nahijan, the same.
So Nahid and Nasrin and Mahbube are from here, right? They're your neighbors? They're from San Diego area?
Yes. No, not me. Actually, I'm from Canada.
Oh, really?
Yeah.
All right.
Nice.
Where did you see it? You're in Afsoon's group?
I guess so. I guess on Instagram from Afsoon. Yeah.
Okay.
He
Perfect.
got me. I don't know. You remember me? In LA in Irvine meeting in October.
For sure. Yes. We were there in a wonderful event, the retreat that was last October. I had the pleasure of having the time spent with wonderful people, one of which was Nasrin Jan, which was an amazing gathering. So thank you so much for following up and joining us here.
Thanks. I'm excited too.
Excellent. So we have Sonia Jan and Afsane. All right.
And there is Kathleen Monk. There. All right.
Hi, how are you?
Hello.
This is Sonia. How's everything?
Sonia John, turn your camera on when you can so I can see.
Yeah, but I wanted to go with my iPad, but I don't know how to do it because there is no username or password. So I just got it with my phone.
Oh, yeah. Okay. I mean, we can see your name. So
Yeah, okay.
you can just turn on your camera.
Yeah, I'm going to do it in like 10 minutes.
Okay, Afsana is here. Hello, hello. Let's see. Shari. Let me see. We're trying to wait for people to come in. So if you ladies don't mind, just tell us where you're coming from, where you heard about us. So it gives us an idea when we want to continue these series, where to actually advertise and, send maybe make lives and send them there and post them so people can see us. So I know Afsana, you're from Santa Monica, California. Yeah.
She's on mute.
She's on mute, I know. I think she's getting ready. Then we have, who else? Sonia is from Beverly Hills. Shari. Do you know Shari?
Shari Jan, can you introduce yourself, my dear?
Hi, am I on mute?
Oh, hi, Sharona.
Hi, how are you,
Oh,
Jasmine?
hi.
Hi.
Alright.
This is great that you guys put this on because I believe I'm pre-menopause and not fully there. So I'm 50, so I'm looking forward to what you have to say.
Perfect.
And I've told all my friends, so hopefully they're going to be tuning in as well.
Thanks for joining us.
Thank you, Sharon. I don't think they can because we are basically sold out.
Okay.
We put a cap on it for 25 people. And I don't know. I don't know, Afsoon, if you can change anything, if people can still add or not.
Not at the moment, but people who have signed in already, they should be tuning in within this time. We have 10 participants. So
Yeah.
I think we'll wait a couple of minutes. We can start introducing ourselves perhaps and start with the program.
Okay. So if everybody is Persian, I don't know, everybody seems to be Persian. We can go back and forth between Farsi and English if you guys like. I mean, whatever I have is in English that I have prepared, but we can switch back and forth. And I think it's going to be easier for Jasmine to speak in English, but everybody's comfortable with English anyway, right?
Both is fine. Both is fine.
Okay. Can I just go ahead before we introduce ourselves about our ground rules that, guidelines that we have? I have some Shore's added coming.
Oh, she found the link. I'm glad.
Yeah. Let me
Our
add.
special guest.
All right, perfect. All right. So everybody is familiar with Zoom. There is a reaction button on the bottom if you're on your computer that has like wave and like here. Yeah. It has this one, the wave, or it has this one, or love, or whatever. So please raise your hand if you want to talk so we can see you. Since every time if we are talking, I mean, I have to be careful when my partners are talking so I don't run into them, but that way is easier for us to see you and ask you to join. Respect each other's opinions and ideas. I mean, menopause and any subject we talk about is going to be interesting, and some people have questions, and that's why we are here. So there are no wrong questions or wrong answers. No interruption while anyone is talking. That's why we have our hands up. And this is a sacred place. So whatever we're talking about is going to stay among us. The lectures are interactive. That's why we want you to really participate and raise your hands. But at the same time, we would like you to hold on to your questions because the three of us might cover it before you ask the question. Before you ask the question. You have another option too that you can, if you don't want, if it's a burning question and you think that you might forget, just put it in the chat and then one of us will see it and we can answer it. So I think, we gave people about 9-10 minutes. If Afsoon, you want to start, please go ahead.
Thank you so much. There are some people waiting to enter also. Dr. Noushin Aziz, if you could please enter them. I just got a text. All right. So,
hold on. Let me see why I can't see them. It shows everybody who was here, they are here.
if you go to chat, check the chat.
No, chat is only from you. menopause. I mean, it's the link to this program. No. Nobody, I mean, nobody's waiting as far as I know. So let's do this. All right. Okay. No, I mean, we can start, and if they come on, we can see them.
All right, so thank you so much, everybody, for being here today. I just wanted to give a little introduction about myself so you know who I am, and then we go rotate. Our co-hosts also talk about their background a little bit before we start. My name is Dr. Afsoon Ghazvinian. I am a doctor of pharmacy, twice board certified in US and in Singapore. And this is where I worked and I lived for about 10 years. And at the time that I was in Singapore, it kind of was inspiring me to kind of switch from a traditional pharmacist into holistic health practitioner. In Singapore, I got the opportunity of working with a lot of the public sector activities in the country, where they did island-wide activities with regards to disease prevention, helping people to really bring in healthy habits to prevent disease. So that, to me, that was such an impactful effect, so far more effective than the medications that I was offering for chronic disease, as you know it nowadays. We're talking about diabetes, high blood pressure, anything that nowadays are autoimmune diseases that are so prevalent. And the medications that I was dispensing are mostly we're using for masking the symptoms for the most part. I couldn't say that I'm, was helping the person to really heal. And the whole process of lifestyle change became something really powerful in my life and in my practice. So when I returned to California about 4 years ago, I completely focused my practice on functional medicine. And right now I am holding group sessions and some one-on-one sessions with clients to really show them how, or kind of guide them and share the practices from the best in functional medicine, what comes out of the best articles, the best, impactful practices that are normally not designed for us at this time of life, as we are going through transition to menopause or we are post-menopause. So all of these are quite helpful. And I mean, for me, the last few years have been the most rewarding, because I can see that these lifestyle changes really help women take control of health, feeling that they're mentally so much more energized in their body, they're feeling their strength, they can maintain their weight. A lot of times we see that as one of the things that is hard to control at this time, and overall feeling confident, knowing that we can really take care of our health at this time and make this one of the best parts of our lives, as we're going to talk about more. So basically, this is a quick introduction.
Thank you, Afsoon.
Sure.
So I am Noushin Nikfarjam. I'm a psychoneurologist, and basically my specialty is in anxiety, fear, phobias, traumas, and PTSD. But I do relationship therapy. I am the author of 2 books, both on relationship, this is like making a commitment for love, and everything is like blurry, but it's psychoneurology of relationships and case studies that I have been running a lot of seminars in the past 15 years on different subjects. One of them was Healing Beyond Medicine series. In that one, I started teaching different modalities for prevention of disease. So people had a huge array of opportunities and classes that they could use, such as Qigong, Ophanim is Yoga with Abraham, mind stoppage techniques, EFT, that is emotional freedom technique that we're going to teach you guys today at the end. We talk about chakras, we talk about different things. Everything is about prevention when I used to teach them. I also had a series of classes on my first book, Making a Commitment for Love. And it was about like a group relationship therapy class. And it was pretty successful. I do volunteer for Bianco Foundation every Wednesday at schools in LA area and teach the kids life skills. And they're very similar to what I teach adults. And here, my job is to teach everyone who participates how to deal with their emotional and psychological issues that come up. Because menopause does create a lot of rage, anger, resentment, the hormonal changes that Afsoon and Jasmine are going to go through. They're going to be extremely tough. I mean, most of you women have already gone, and Sharona just said that she thinks that she's premenopausal. So I recommend that men join our classes, because since women go through these changes, men who are living with them, they as well go through changes in life. And theirs is andropause instead of menopause. So as the classes progress, we're going to touch upon those. So I'm the relationship therapist of the group, basically. And very glad to be here with all of you. So Dr. Jasmine Talei.
Thank you. I'm Jasmine Talei. I'm a licensed naturopathic doctor. I have a private practice here in Beverly Hills, and I focus on hormonal health and gut health. So I see both men and women who have from different ages. So anyone going through a difficult period, and then as you get older and you go through perimenopause and menopause, I treat many women around that time period. And I also have another focus on gut health. So I do a lot of comprehensive tests that look in, not Noushin, you're shaking your head.
No, I'm sorry. No, I'm
okay?
talking to you. No, nobody's waiting. I'm so sorry.
I'm actually going to take off my.
Yeah, no.
It's echoing in my ear. Okay, you hear me, right?
Yeah.
Okay. So I also focus on gut health as well, because our gut is so tied into our hormonal health. So I do comprehensive tests that look at our gut microbiome to determine if there's an issue with certain foods that we eat that cause us to bloat or not absorb certain nutrients and things like that, or if we have an overgrowth of certain bacteria that causes inflammation, which is also a big thing as we get older and we go through menopause. And then for hormones, I also do a lot of comprehensive tests that look at the metabolism of our hormones. So I don't only look at your specific hormones, let's say estrogen, progesterone, testosterone, thyroid, but I look at the metabolism of them, how they get broken down in your body and how they all work in balance with one another. Because at the end of the day, it comes down to how they work together in balance. And then I treat based on making lifestyle and dietary recommendations. I do a lot of herbs in my practice. So various herbs provide us with various nutrients, help support our hormone production, help with our gut health, with our detoxification process and all of that. I also use a variety of nutrient therapy. So whether that's ingested orally or injections, I also do hormone replacement therapy, bioidentical hormone replacement therapy, peptide therapy, homeopathy, basically all of the natural things to make us feel our very best, energized, optimized, and just overall feeling good. So we'll be talking about all these different things. I will be focusing on hormone replacement therapy during this discussion. And if you ladies and men have any questions, feel free to ask. We'll go through hopefully a whole variety of different topics.
Thank you. Would you like anybody to introduce themselves?
If anyone would like, they can introduce themselves.
Yeah.
And if there's anything that you want to explain about what you hope to be getting out of this, then we can definitely make sure that we cover that as well. But it's up to you if you would like to participate or not.
Yeah. I mean, if anybody would like, otherwise we start. Okay. Afsoon John.
All right. Well, thank you so much. Again, as we mentioned, that this is going to be an interactive conversation. Just anything comes to mind, any questions, please write them in the chat box for us so that we can remember to touch on or raise your hand so we can actually have that discussion. So when it comes to menopause, I think for the most part, this is an introduction. We want to start the conversation. This is something that nobody is really talking about. Nobody really, for the most part, we might not get the information that we need to know exactly what menopause is, what it is that we need to kind of watch for as we are going to perimenopause and menopause. And interestingly, the word perimenopause was coined maybe no more than 10 years ago. It's very new. At the time that I was in university for years, we had menopause. And we thought, okay, you know, we are through our hormones, we are through our cycles, and then here we are in menopause. But now we see that there is a long period of time before actually we are getting into menopause, that there are this maybe 7 to 14 years of changes. Our bodies need that time of perimenopause, as we call it, to get us ready and get us really kind of in tune with this hormonal decline. And usually this time can start from early 40s. As early as early 40s, we can start seeing some of those signs and symptoms. The cycles are starting to change a little bit shorter, a little bit lighter, sometimes even heavier, mood change, a little bit of a change in our metabolism, of course, that we can't really sometimes lose the weight as we used to. Even a few months back, you know, we see that things are changing for us. A lot of times I hear from women fatigue, you know, I'm feeling very tired, like by the afternoon, they say that I'm just done with the day, and really my energy tanks when it comes to a certain part of the day. And of course, sleep as well. And all of these have domino effects. Like if you're not sleeping enough, we can also feel tired. Everything affects on our mood and everything. So altogether, this is a huge change, as you must agree with me. And you know, we are at the time of life also in menopause, you know, during this time that at work, for the most part, they are still really working very hard to get to the positions that we really worked for many years. You know, it's still harder for women than men to get that seat at the table, to get that promotion, to get to the, you know, wages that are really rightfully they deserve. So we should, you know, we are working harder. And then at the same time, we come home, and then who takes care of the family is still, you know, children and everything that is around us. So a lot of pressure for women, and the community that our parents or our mom and grandmothers used to have as far as the support, it may not be as much, especially in the past couple of years. That's also lacking, and we don't have that support. And a lot of times, sometimes another layer of pressure is, again, you know, maybe our elderly that we're taking care of, or mentally, physically, we are involved. So there's a lot of pressure for women and children for that matter. They're either in teenage years or they're transitioning to university, and that's a stressful time for everybody. And as I call it, like when you take your car to the shop and then they lift the hood, you lift the hood of this woman who is so bravely doing all of these things, and you see the whole slew of, you know, things going on because of this transition in hormones. So certainly this is a very critical time to really start taking a look at. And for me, as a pharmacist for many years, I've seen how these, you know, long-term diseases slowly develop. And to me, the more important part of it, rather other than all of these symptoms that we are experiencing, as Dr. Jasmine just brought up some, and she would be talking a bit more about physical changes that we will experience at this time. The long-term effect is really crucial for us to start really thinking, okay, I do have almost half of my life ahead of me. How can I really support my body, support my brain function, support my hormonal changes, because this is natural. Let's face it, it's not a disease, right? So we all go through this process, but this is us right now to start really supporting all of our symptoms and all of our systems for that matter. And one of the things that happened through this shift of decrease in hormones or decline is that the hormones are almost like a protective shield for us. Up to the age of menopause, heart disease, a lot of other like a stroke, maybe affecting on the brain health are higher in men than in women. But as we cross menopause, dramatically the risk increased. So that we should start thinking, okay, really, if I want to live those next half of life, I would say, ahead of us with now longer period of time that we live, how can I really make those little changes? And these we're talking about small habits that we can actually bring into our lifestyle, because my part is somewhat, mingles with the part that Dr. Jasmine does as far as hormones. And if we really need to introduce additional hormones, that has its own place. But at the same time, they really are so interconnected, because we really need to start understanding first, learning the importance of changing our lifestyle at this time. And again, learning how to make it practical and simple and fun so that we can keep up with them. And really, we see how much it affects our overall vitality, like waking up in the morning and feeling energized and feeling that nice, this is a nice new state of life. But again, we need to create the condition for our body to adjust to this hormonal change. If any questions up to this point that I can address, please help me writing in the chat. So just a couple of things also that I wanted to mention about brain health, because some of the things that they have actually, the research that has been done on women, it shows that really we deal much more than men as far as a percentage with depression, with anxiety, also with headaches, with migraine headaches, especially at the time that our hormones are fluctuating, and with dementia and Alzheimer's disease. And they also have done imaging on brain of women, and they've seen that along the menopause time and after that, those little things that happen, actually, the plaques in the brain that can contribute to Alzheimer's disease, they are stating to rapidly grow. It doesn't mean that, really we are going to develop Alzheimer's disease, but it shows that the risk would be higher, just because the hormones are declining and our brain is adjusting to this new time. And that also has a direct effect with our food that we're ingesting. Basically, they call Alzheimer's disease type 3 diabetes now. The increased blood pressure, blood sugar that actually affect our brain cells as well. So really, to me, bringing in these modalities, the nutrition, how we nourish our body is quite important. These things might, seem very simple and really not as, so sexy as we want to go and do a very expensive detox, or we want to get the best pills or anything that we can find, the supplements. But at the end of the day, we have to realize that the foundation and the basics of a lifestyle that our body really thrives and really craves at this time, we need to start providing it for ourselves. And it's just kind of consists of nutrition, how to nourish our bodies, how to move our bodies during the day. Our movement changes from the time that was before. We go to the gym for an hour, very hard exercise. Things change at this time. How important it is to build muscle mass. Nobody talks about muscle mass. It actually is an organ of longevity. We need to start thinking about building muscle mass, our upper body, lower body, and also thinking about how we can recovery, rest and relaxation, self-care, and a community that can actually support us through this time. So, is that my phone? I'm sorry if that was a ring. So basically, these are the foundation of the work also that, I work with the groups or with people that I work with. And through years, these practices have become really curated and really simplified into small stacked practices so that with minutes at a time during the day, we can actually gain a lot of impact and a lot of effect on our health markers, on our blood sugar, blood pressure, all of that. And at the same time, we can see that we can really maintain our weight so much more easier. We feel so much better in that sense, and overall feeling so much more confident in our ability to take care of our own health. So basically, that's how my philosophy and the structure of my work is around. So I think that at this point, I wanted to also, anything that Dr. Noushin or Dr. Jasmine wanted to add?
No, not yet.
So I also wanted to
We have a question.
Yes, please.
Ben, go ahead. Please turn your camera on.
Oh my God. Okay.
Yeah.
You're on the spotlight.
No problem. You mentioned menopause start from, maybe from age 40 and go up to whatever. Does menopause comes and goes? Some ladies can get a menopause, then they get it stopped and come back again.
Well, thank you for your question. And a lot of times these are the questions in a lot of ladies' minds as well, and we don't really learn about that. So at the time that we start seeing fluctuations and changes in our cycle, in our period, basically that is the time that we're calling perimenopause. As I mentioned, it may go on from the age of 40 to around 52. 52 is the common time of menopause in the US. And, around this time. So during this time, it may be we just, the periods may stop for a period of time, maybe for a few months, and then they may come back. And basically, menopause is the time that 12 months after our very last period. So if we don't have any periods happening for 12 months, that day, it would be marked as menopause, and then we will go into post-menopause after that. So basically, menopause is just one day, but we are into perimenopause for months, and this is so different based on individuals, based on their lifestyle, based on how they're dealing with it. It may vary.
So can I add anything? That's the reason I say men should be here, because actually, I remember when I was on my cycle, right before, like 24 hours before, I would become extremely, extremely angry. So one of the symptoms of premenopause or, menopause or anything, or premenstrual periods is because of the fluctuation of the hormones in the body and estrogen and everything that's inside the hormones that Jasmine and Afsoon are going to be talking about more in detail. Those changes, first thing that they do, they affect our emotions. And a lot of men don't understand why the wife out of a sudden snaps. And imagine what we go through every month when we are getting our periods. And then premenopause starts from somewhere says mid-40s, somewhere says 51. It all depends on the individual. But those years are tough. And then the irregularity of the periods, that's another issue, because the body is going through changes and the psyche is going through changes. So the woman really is going bonkers, honestly. It's very, very tough. Then 12 months, you're basically not getting your period, or you're getting your period once, and 5 months later, you get another period. And that's scary because you don't know what the body is doing. I mean, what changes are going through. Then for 12, 13 months, as Afsoon said, there is no period anymore. And you have been menopause, but still a lot of times, when we used to get our periods, like a couple of days before that, our body has its own clock, and we might start getting upset, angry, for no reason whatsoever. So I mean, I'm just saying, Sharona, welcome. Welcome to the next roller coaster of our lives. So that's why it makes it so tough. The estrogen is linked to these neurotransmitters that affect emotional pathways all the time in our brain. And we need to have tools in hand to deal with it for men and women when it comes to that. So I don't know, Afsoon or Jasmine.
Yeah, and I'll add something about that. So this period of perimenopause can actually take anywhere from 5 to 10 years. So that's why when Ben asked about, it's funny calling Sefer Ben, asked about, does it come and go? Like, are you menopause one day and one day you're not? Once you hit menopause, like Afsoon said, you stop your period for a period of 1 year. You also do labs, and there's a marker called FSH. And when that's elevated past a certain amount, that's how you know that you actually have joined this menopause. But for 5 to 10 years prior to that, and that age can range from anywhere from like 40 to 50, it can fluctuate. But for 5 to 10 years, basically you get these symptoms, you'll get your period one time, and then you'll miss it for 3 to 4 months. But at the same time, you'll probably also get other symptoms. So some women start getting chronic urinary tract infections because of the vaginal dryness due to the drop in estrogen. Other women, like Noushin was saying, you get angry or have insomnia, so they can't sleep. And that's because of the lack of the progesterone levels, which also mimics, it's very similar to when women go through their period, and there's the time period right before where we say PMS, their progesterone drops, and they also have these symptoms of anger, irritability, they can't sleep well. So for a period of 5 to 10 years, this can happen back and forth. Or like they'll feel like they have low libido, low sex drive, or they'll have weight gain. All of this because of the fluctuation in those hormones. And then, and then once they hit menopause, that's really just defined by that 1 year mark of no periods, the FSH being elevated at the same time. True. Any other questions before we move on? Okay.
Thank you so much for the points brought up, definitely. So these are the things that actually keep in mind, and these are the kind of education I think these discussions should be so much more so that we can actually start talking about it. So what I wanted to add now, because, we're talking about lifestyle changes and why that is so important in declining of our reproductive hormones. Basically, we are seeing decline in estrogen, progesterone, and testosterone throughout this perimenopause time. And just keeping in mind that we can't really look at just the reproductive hormones in isolation. All of our hormones in the body are really so tightly interconnected. And if we look at all of the structure of our hormones in a form of a pyramid, like imagine a pyramid or a triangle, at the very base of it, the most important part at the base is insulin and cortisol, meaning how can we actually on a daily basis, how are we taking care of our nutrition, of our basically our insulin level, our blood sugar level, and also stress level. So these are so fundamental. If these are something that we are not paying attention to, and we're just trying to correct the hormones, then it may not. It has to be really in a nicely balanced combination so that we see the best effect if we're also adding hormones, or if you're thinking that we want to naturally balance our hormones. Either way, this is the base to consider. And really increase the stress, and not knowing how to manage the stress also affects our blood sugar. That also increases and spikes our blood sugar, as well as not sleeping enough. These are things that we really need to start paying attention and see how we can balance our blood sugar level. That is such an intricate and important part of our health overall for all of our systems, as well as for our brain health.
And the hot flashes.
And the hot flashes as well, for sure.
During the day or at night. I mean, I can, bet that each and every one of you who has gone through menopause, you know that at night you're sweating so bad that the whole bed might get wet, so that causes lack of sleep. And when you are like a zombie because you didn't sleep well last night, that causes issues. So these are the things that we want to talk about when we are together at all times, and see what we can do to ease it for ourselves and for our family, because the minute the woman of the house is not happy, the whole thing is ruined. The foundation is not working. So
that's very true. That's very true. And I think, the mom always, or basically the woman in the family or in the workplace, everywhere that we see is like the source, is just providing information, care, support, mentorship. And in that sense, at this time, we really have to start putting our health on top of the list, because, as I say, sometimes in menopause, it's almost like we are going through a second life. It's like another birth, if you agree. So, and this time, the beauty of it is that we are both the mother and the child. So that we have to really take care of that child inside of us and see, okay, we've done a lot of duties for everybody else around us up to this point. And if we really want to do better for them, if we want to do better for our career, for our family, for our children, first of all, we have to take care of our health, so that in the long run, we have the energy, we have the health that we need. And also we are not, in a sense, I think, not being a burden to the family, to the children. That's also something in the back of our mind, that really we need to take control of our health now and really enjoy this time, because it can be a wonderful time of life as well. Like the periods are behind us for the most part. If we want to be getting to that point, children are more independent. We have so much more wisdom, intuition, as these hormonal changes going, this amazing amount of intuition comes in. Like we just have to me, I think one of the most important part of it this time is to create some space, some silence. You may call it meditation, you may call it just a silent time, journaling, whatever it may be, to really let that inner voice start echoing, and kind of listen to that, so that when we say we both are the mother and the child, so see what is the inside needs and wants and desires, and really caring for those is such a big component of health. Because if we ignore that and we just say, okay, I'm just all about the best nutrition and the best, trainer that I can get for my body and all that. But, at the end of the day, if we're not really feeling good within us and inside us, and that inner peace is not initiated and nurtured on a daily basis, we may be having a hard time really achieving much from even the most amazing, care around us. So really goes back within.
I just want to add something, Jasmine. I don't know if you want to add, but regarding journaling that you said, that's one of the things that you have to start doing, stepping back, recording everything. Like if you exercise that day, if you ate too much sugar, if you had too much caffeine, anything that you have done, keep a track of it for 2 weeks at least, and see how your mood changes by what you eat and what you do during the day and how you sleep at night. So journaling is extremely important if anybody can do that, at least for 2-3 weeks. Dr. Jazz, you want to tell us anything about what to do with our wacky hormones?
Yeah, I could go. Do you want me to go into that now, or do we want to do a little bit of Tai Chi and get up and then let's do that. Let's get up from our seats, do a little bit of Tai Chi, and then I'll go into what we should do with our hormones.
Oh, wonderful. So because, we're talking about small practices daily, I thought, let me see. Can you guys hear this a little bit? I don't want it to be too loud, but a little bit of music on the background as well. So basically, to me, Tai Chi, after many years of spending in Asia, I found that is a combination of energy movement as well as breath, because a lot of time we say, okay, we need to breathe more consciously during the day, but just sitting and breathing, this one, when you move at the same time, it actually amplifies the stacked that I was talking about. The short amount of time we are doing breath, energy movement, moving our body, as well as gaining balance and really feeling so much more centered. So if you would like to stand up for a few minutes, I'm going to show you just a few moves that I normally do during the day when I have some time, and especially at night. I love to do it in the evening before bedtime so that it gives my body some nice stretch before the day is over. So can you guys see me a little bit? Let me see if I can bring. So basically, we are standing straight up with our feet shoulder width apart. Your feet, just the same width as your shoulders, kind of your knees soft. And imagine that there is a center of energy, like 4 fingers below your belly button, like around here. This is a center of energy that we are bringing the energy into this center and nourishing this. So first of all, I want you to take the energy from the environment. Just take the energy, inhale and exhale down. One more time, inhale. Bring it down to this area of energy. So this is also a stretch. Inhale. And at the top, exhale. Wonderful. Next, I would like you to take this energy, we're moving energy as well as breathing, inhale, exhale, and stretching. So bring the energy up with an inhale to the heart, then flip and exhale up all the way, stretch. And inhale back down to your chest, flip and exhale down. One more time, inhale, take the energy to the heart, flip, exhale up, then inhale down, flip and exhale down. So kind of imagine you're moving the energy around. Next, take one hand up, and as you're coming to your inhale, in your heart area, inhale, bring your hands to prayer, inhale, and exhale, one hand up, one hand down. So you're sort of stretching. The hand that is up is like facing heavens, and the hand that is down is facing the earth. Stretch, then inhale at the heart, exchange energy, and exhale again, another stretch. Your hand facing the heavens and the earth. Last time. At the heart, exchange energy, inhale, and then exhale as you stretch. So this is a great stretch for the midday as well. Next one, I want you to same movement, just put your feet a little bit wider, One hand up again, the same. As you're changing the energy in your inhale, on your exhale, twist this very slightly. Very slight twist. So your body just kind of get a nice stretch. Then again, inhale in the center and exhale, twist very gently, very small twist to the side. 2 more times. In the center, inhale and exhale, twist. Inhale at the center and exhale, twist. Wonderful. Now, next one, I would like you to put your hands down and then feet again, shoulder width apart. As you inhale, if you can see my hands, as you inhale, you bring your hands inside, twist in, exhale, twist out. Your shoulders relaxed. Inhale, twist in, exhale, twist out. One more time, inhale and exhale. And the same thing, hands forward. Inhale, twist in, exhale, twist out. Inhale and exhale. A lot of times we're working with our computers, with our phones. So these are very gentle exercise, stretch, and breath. And one more that I would like you to do is like a long inhale. You kind of get your body into a long inhale and then exhale down. So it's a very long inhale. You touch your body like this. So give yourself a massage on the side. Inhale and then exhale down. Last one. Inhale. Hands forward. Exhale. And the very last move, I want you to give yourself a big hug with an inhale. Hold your body and exhale out. Another inhale. Hold, stretch, and exhale. Wonderful. And before we finish with that exercise, I would like you to bring your hand to your heart and do an inhale for 4, hold, and an exhale for 8. You can go like that. Last one, inhale for 4, hold, and exhale for 8. Wonderful. And it's been shown that exhaling longer than inhale really helps our body to get relaxed. So I hope you enjoyed this very short Tai Chi Qigong practice.
Thank you.
That was incredible. I truly enjoyed it.
Yeah, thank you so much.
My pleasure,
Yeah.
my pleasure.
Afsoon, do you have a link if anybody wants to watch this on their own, or can they go anywhere?
Yes,
watch?
I do have this practice. I've recorded it, so I would post it on my website, and I would just put links on my website. You can check that. It's not at the moment, but if you would like, I will post it there. So this is something that you can, as a resource, take a look at. It's just kind of a shrinked time, because I think we just we sit too much. To me, sitting has to be, we need to find ways to really earn our sitting during the day, because we would burn so much more calories. We need to move around as much as we can and stretch as much as we can, because our bodies get really stiff when we are sitting for a long time, or even when we wake up in the morning. So once we do these stretches with breath, it's just life-changing. So thank you for coming along with me and doing this practice.
Thank you.
Thank you. Okay, so we can go a little bit into how to mitigate these changes. So when we go through menopause, perimenopause, and menopause, what are some ways that we can kind of just not speed up the process, but not feel it as much? So a big one that Noushin was saying is sleep. And if you don't sleep well, then you're very unhappy. And I know a lot of times around this time, people turn to pharmaceutical medications because they can't sleep, or anxiety medications and things like that. And it's not really always necessary, because a lot of times it's just something that's going on with your hormones that you need to address more than anything. So there are a few hormones that I'll talk about and what's going on with them. So I'm going to talk about the sex hormones, so estrogen, progesterone, testosterone, as well as the thyroid. And the reason I want to talk about the thyroid, it's because it seems that almost everyone has some kind of thyroid issue. And as we get older, our thyroid also changes, our thyroid health changes, and our thyroid is very much responsible for our hormones and how we feel and our mood and everything. So I don't want to neglect that as part of it. So there are a few things that when women come into my office and they say, I can't sleep, or I just feel agitated, or I'm sweating all the time, I have these hot flashes, and I just don't feel like I can go out and about in society because I always have these hot flashes. I've had people come into my office and they've just been so nervous and full of anxiety that they've said, I just want to jump out the window because I just can't take it anymore. So I know it's a lot that goes on with people around this time, but it doesn't have to be this way. Just because it is common doesn't mean it's the way to go about things. There's always things that you can do. And I think a lot of times as women, we're not educated about this. The amount of people that I've seen women go through menopause and they come to me and they're like, I tell all my friends about this. How have you, like, why didn't I know about this? Why isn't this talked about? If I just knew that everything will get better, then I would have been so much happier. And I can talk about specific patients too, to keep it more interesting as well. So a typical patient, and I'm thinking of one particular, was going through a very hard time. She was about, I want to say her age was 56 years old, and she was going through menopause. She had hit menopause. She wasn't getting her period for over a year. She had also recently gone through a divorce. She was taking care of her parents. She had that responsibility as well. She had a lot of bloating, inflammation. She had very low energy and mood. And she came into my office with all of these symptoms, and I remember the first time she sat there and she just kind of like didn't believe there was any hope for her. She's like, you know what? I've been to all these doctors, but here are my symptoms, like, just like whatever. And I remember thinking, is she even going to follow through with the plan? But she did. So we ran labs, we did blood work. We found out what her hormones looked like. And we did a few different herbs and we did a few different topical hormones. So when I talk about hormones, and I'll come back to her as well, but I want to discuss, when I talked about hormones, it's not those scary hormones that you hear about that are cancer causing, and, oh, like my mother had like some kind of estrogen dominant cancer, so I don't want to go on these hormones. It's not those hormones. These hormones are made in a compounding pharmacy, and they're oftentimes a combination of different vegetables like yams. And they mimic, so they are exactly that exact hormone in your body that is being reduced during menopause. It's not when you go on birth control and you take a synthetic hormone and it makes all your other hormones change and it gives you long-term issues. It's not that. It's that exact hormone that your body makes. We're replacing it, and it's a natural form of it. So that's what I'm talking about when we say hormones. And there's different methods that you can do hormones. You can do creams on your skin, and that's usually the first thing I do, the easiest thing, and people usually stay with that. You can also do injections, so shots. You can come into an office, a doctor can give you a shot. You can take oral tablets. You can also do pellets. So it's a procedure that you put under your skin. A doctor does it for you, and it stays in your body for a period of 4 to 6 months, depending on your heart rate, on your metabolism. So there's different varieties of hormones that you can do, but the ones I'm referring to in general are all the natural ones. And I just want to make that distinction. And the good thing about natural ones is that you can determine which hormone you want in your body. So we have 3 different estrogens, for example. We have the first estrogen, estrone, which is the one that's not really good for you, is the one that's associated with certain estrogen dominant cancers like breast cancer. So when I prescribe certain hormones, I make sure I don't want the estrone, I want the other hormones. So it's nice that I have that ability to create those specific hormones that are actually good for you. So E2 is estradiol, and that's the one that is important for your brain health, for your bone health. So when we go through menopause and a lot of women are diagnosed with osteoporosis, it's also because their estrogen levels drop, specifically the estradiol. And then E3, estriol, this is the protective one. And this one is actually, it works really well. And sometimes this is all I use for patients. And the reason I really like it is because it's actually been proven to be very protective against certain kinds of autoimmune conditions that we get as we get older. So it's very nice to use these more natural hormones and have the ability to only use those natural ones and not use the bad hormones that are associated with certain cancers. So that's what I'm talking about when we discuss hormone replacement therapy. So back to the patient who wasn't feeling well. She was 56 years old and she had all these symptoms and was going through a really hard time in her life. So we did labs and I put her on 3 different hormones. I put her on testosterone because her testosterone levels were low. When your testosterone levels are low, you oftentimes, you have no sexual desire, you have very low energy levels. You cannot put on muscle. So you work out all the time, you have the same workout routine, but you have that arm flab. Whatever you do, it doesn't turn into muscle. So that's a function of testosterone. The other one, I put her on specific estrogens, the good kinds. I also put her on progesterone because she had a lot of high anxiety that was associated with her age, but also her lifestyle and the changes that she was going through. And I also put, and progesterone also because of just her irritability that she was feeling as well. So I put her on these hormones and she came back for a follow-up the next time. And hormones act quick. They're not like, I always say like herbs will act a little bit slower. I love herbs. It's the main thing I use in my practice, but hormones are quicker. So she came back for a follow-up in 2 months and she's like, Dr. Talei, my whole life has changed. I'm not inflamed anymore. I got a boyfriend. I'm having tons of sex now. I have so much energy. Everything is wonderful in my life. And she was just so happy about all the differences that can be made. And also a little bit frustrated that she didn't know about this to begin with, because it's not something that we talk about, especially in this community of Persian women. It's not something that we discuss a lot about, like different hormone replacements. We tend to be more on a fearful side oftentimes of this hormone is going to cause cancer and therefore I don't want it. Well, while there's no studies actually out there about bioidentical hormones causing cancer or blood clots or things like that we are very fearful of in general. So that's one case study that I wanted to bring to your attention, kind of to just explain how it works. And then I also do a lot of herbs in my practice. So for someone that doesn't want to do hormones or wants to optimize those hormones at the same time. So let's say we do blood work and we find out that certain estrogens, the bad estrogen, so estrone, E1 is elevated. And we see, okay, this E1 is elevated. This woman might be at risk for certain estrogen dominant cancers should the E1 continue to progress. So at that point, I use certain herbs to help reduce the estrogen. I also do certain tests that look at your gut microbiome to see if there's an issue with detoxing. Those, the estrogen specifically, there's certain markers that I look for to determine that maybe this person has an issue with their liver health and they're not able to eliminate certain bad estrogens from their body. So I use different herbs to lower those estrogen levels. I also use certain herbs in conjunction with progesterone to lower anxiety levels in women, to lower that anger feeling that Noushin was discussing as well, and to reduce hot flashes at the same time. And herbs, I love herbs just because herbs provide us their food. They provide us with nutrients. They come from the ground. Like we need these herbs don't just give you one effect. I've yet to see an herb that just has one effect. They give you nutrients. The same herb can help with anxiety, but it can also maybe help with hormones or with detox or things like that. So I also use a lot of herbs in order to mitigate that pathway. So we talked about estrogen, we talked about progesterone being the calming one, and then also testosterone being the one that's for energy and putting on muscle mass, and also for just for overall well-being. Also testosterone, because we had mentioned andropause. So also men after age 30 actually start their testosterone declines. And oftentimes they will also feel like they are low energy and they can't put on muscle no matter how much they work out, or they have belly fat, or what they say man boobs, like breast tissue that they can't get rid of. So definitely there's a lot of correlations between menopause and andropause where hormone levels drop. And then the last thing that I wanted to talk about is thyroid. So our thyroid is so important. And oftentimes it is so overlooked. Whenever you go to a doctor's office, usually in your regular blood work, whenever they check for your cholesterol levels and they check for your liver health and things like that, they also add in one thyroid marker. One thyroid marker. There are so many other thyroid markers, but for some reason, insurance companies or whatever decided we are only going to test for one thyroid marker. That one thyroid marker, thyroid stimulating hormone, it tells us a lot about your thyroid health, but it doesn't tell us everything. And as you get older, and you might feel like you get cold more easily, or you get hair loss is a huge one, or weight gain, or maybe your eyes bulge out a little bit, or your hair at the outer thirds of your eyebrows on the sides, they start thinning, or your nails break easily. These are all thyroid issues. And it always gets overlooked. And when I ask women, I ask them, did you get your thyroid checked this year? They said, oh yeah, I did it, but I did it like 3-4 years ago. 3-4 years ago, a lot has changed since 3-4 years ago. Not to mention your age, but also the environment that we live in and what we eat and what we're exposed to. That's not always in our control. So definitely your thyroid is something that needs to be checked. And you always want to, so there's a lot of other markers that check for thyroid health. And the big one is to make sure that your thyroid is converting accurately. So it's converting from the T4 that I'm sure some of you that are on this Zoom are on thyroid medication. And I'm willing to bet the thyroid medication that you're on is Synthroid, T4. But you have to make sure that it's activating your thyroid hormone, your T4 is activating. It's actually working and functioning and converting to your T3. If that's not occurring, which a lot of times when we get older, our bodies become more sluggish. If that's not occurring, then your thyroid is really not functioning well. And that also, I forgot to mention, constipation is a big one. And of course, if you're constipated, it's no fun to be constipated. When people are constipated, they're irritable, they're bloated, they're inflamed. This is also part of your thyroid health. So if you're not converting certain hormones accurately, you're going to have all of these issues. But the whole point of all of this is to say that this is not how your life has to be. This is just because this is what maybe your friends are going through and you think this is common. This is not what needs to be your life. There is so much out there and so many ways that you can actually optimize the way you feel and feel good and take care of yourself, and in turn for the ones that you love and your family in natural ways. You don't have to turn to pharmaceutical medications if you don't want to. You don't have to take sleep medication or anxiety medications. There are so many alternatives that actually address the root cause of the issue. The root cause being these hormone fluctuations that are going on. So there are a lot of there's just so many options out there. And I'll let you, if you guys have questions, you can feel free to ask and we can go from there.
Wonderful. Thank you, Dr. Jasmine.
Thank you. Yeah. So let me ask you a question. The thyroid test is only a blood test or urine test or?
So the thyroid, yeah, that's a great question. Thyroid test is a simple blood test. If you actually ask your primary care for it, if you ask them to do a full thyroid panel, most primary care doctors will do it for you. It's just it's not their first line always. However, if you advocate for yourself, and a lot of what we're sharing is for you to know how to advocate for yourself. So if you go into your doctor's office and you say, I want to do a full thyroid panel, most likely they will do that full thyroid panel for you. It's just a quick blood test that you do any time of the day is fine. You don't need. The only thing is that I've seen that gets overlooked for all you women who are taking biotin containing supplements for your hair growth. That's a big interaction that I also see that a lot of doctors don't talk about. People take biotin and then they do a thyroid test and then it doesn't show up accurately. So, but definitely this is a lab that you can easily just go in, quick blood draw, find out the results, usually like the next day, and then go from there.
Thank you so much. Just one note I wanted to add to that, Jasmine John, is that sometimes even the reading on these markers also, the one that we see on the just any everyday lab panel may not be the optimum reading as well. So we want to make sure that we have, just read them also in a way that it makes sense so that, just consulting a naturopath or functional medicine, I think that will really help because nowadays, even when we're looking at some other tests that they may not be part of our yearly lab panel, and one of them is vitamin D3, which really affects everything else in our bodies, really, really for immunity, for our overall health, for heart health is so important, and nobody really measures it on a yearly basis. And unless we know where our levels are, we can't replace them. And the levels on the lab panel are really bare minimum. And we really want to be much higher than it actually says on the lab panel. So interpreting those lab results are also as important.
Ben has a question, but before that, I just want to ask this from you two. Do you think that all the doctors have enough information to understand and be able to read the results of the thyroid test? Because it's not something that they usually do themselves, or they have to send their patients to people like you, who are experts in this area, either functional medicine or naturopath or hormone therapists.
So I think it depends on the doctor. A lot of doctors are well versed in understanding thyroid labs and even the more specialty tests. So it really depends on the doctor you find. I found some great doctors out there who are very open-minded and know how to either refer to me or know how to read certain labs. The only thing that I would say is the treatment that you get might be different. So oftentimes if you go for your thyroid issues and they find out that you have low T4 or low T4 and T3, they'll give you certain pharmaceutical medications to like Synthroid and Cytomel and things like that to really and they'll put you on a bunch of different medications. But if you go to more of a functional medicine doctor, we're more likely to give you something more natural, I would say. So like things like Armour or anything like that, or various herbs. So I think the modality of treatment is a big one. But I would hope that most doctors know how to read thyroid labs.
I hope so.
And also another thing is with thyroid, one more thing is the foods. So I always address certain foods that people eat. So that's a big difference also. There's various foods that affect your thyroid health. And I feel like that is a whole other session. And yeah, there's a lot of other things out there.
Yeah. Thank you.
To add to that, we don't really get that from our primary, maybe just to look at everything, because as you mentioned, gut health, leaky gut, these are the root cause of why our thyroid is being basically attacked by our own body. It's the autoimmune basically disease. So looking back, and it is what it is that we're doing, what it is that we're eating, as you mentioned, environmental toxins, the food that we're ingesting, and gut health all comes into play, that sometimes we don't look at it in our primary care, basically when we refer to our doctor, but kind of be aware of these and start looking into all of these factors would really help.
Thank you. Mr. Ben, please go ahead.
Jasmine mentioned men's boob. Not lately. I've been start getting a men's boob. To me, I'm not happy about it, but I'm not that unhappy to go get, do something about it. So you telling me if you, by the way, I did my testosterone test done, it's fine. I have thyroid, but it was in borderline. So you telling me if I do some more tests on my thyroid and all that, is it gonna go away? I'm just curious, do I need to go do the plastic surgery, or I need to can take, natural medicine to take care of it?
Yeah, so you probably don't need plastic surgery unless
I'm just joking.
but you can probably do that. So with man boobs and belly fat, the big one is testosterone levels. So yes, your testosterone level might be in range. The reference range for testosterone, if you look on your lab values, it's pretty big. So it means it could be probably on the lower side of things. However, the big one that I look at for man boobs and belly fat is estrogen, specifically estrone, the bad estrogen, the one that's related to estrogen dominant cancers. So whenever that's elevated, oftentimes you will get those man boobs because estrogen hangs out, I would say, in fat tissue. So if you have high levels of estrogen, you also have more fat tissue because that's what it thrives on. And then to address the thyroid, you said that it's borderline. So I'm wondering if they only checked one marker for thyroid, or they checked the whole thyroid panel and what everything else looks like.
I'm not sure, so I don't. So actually, I'm gonna go do. I'm gonna do another checkup by next month. So I'm gonna make sure they do what they need.
Yeah, ask for estrone and also ask for a full thyroid panel.
Perfect, good. I got another question for you. Why? If I'm going to take, let's say, testosterone medication, not medication, herbal, why do I need to come to you versus I Google it and see what are the best testosterone medication that's in the market naturally? Seriously, I need to know, because to me, anytime I want to do something, it's just, that's what I do. I usually Google things, what the reviews are. I know by coming to you, you specify it to me. You get, after running all the tests and all that, you get it to me like, hey, do this and all that. What, to me, it doesn't work what I'm doing. By the way, if I'm going to take something, I can go Google it and figure out what I need to take.
Definitely, when you take testosterone, it's a good idea to check your lab.
No, testosterone wasn't just something I brought up. Let's say I'm going to take plus red rice, okay, or something that is any natural medication, because I'm a big fan of it, by the way. I really believe in it for prevention, not for cure.
You said red yeast rice?
Yeah.
Yeah, for cholesterol, okay.
Yeah.
No, these are all great questions, and they're actually very good examples. So I have answers for both of them. I think they're great questions. So for testosterone, the reason why you wouldn't just Google is because if you have increased level of testosterone, it also has side effects. And also a lot of those supplements that you take on, that you find when you Google, have interactions. So if you have any kind of medical condition, or you are on any other herbs or other medication, they can interact with each other. With testosterone specifically, whenever your testosterone levels are too high, it converts to DHT, which is another hormone, and you will start losing all of your hair. It also, if it's too high, you will become so irritable that just someone saying hi to you can freak you out. So there's a lot of side effects with that.
Sure. So I got it. Actually, you answered my question. So by coming to you is gonna help me or someone like me get adequate amount of the whatever vitamin they need versus just go and get it through their own research.
Exactly. It's more specialized to your needs. And then also, I think the fact that you brought up red yeast rice is such a good example, because most people think, you know what, I don't want to go on a statin because it will affect my brain health, because it will inhibit HMG-CoA reductase, which is a pathway that basically, not to get scientific, but it also will minimize a certain enzyme that your body needs, CoQ10, which is important for your brain health.
Sure.
So a lot of people don't want to take a statin for this reason. They go to red yeast rice, but what they forget is that red yeast rice has the exact same mechanism of action. So it's equivalent to taking a statin. It has the same side effects. So you might as well, it's the same exact thing. So when someone comes to me and they say, I don't want to go on a statin, can I take red yeast rice? I never put someone on red yeast rice. There are so many, there's a million other things, herbs that support your cholesterol levels and lower cholesterol, that are so much better without those side effects. So oftentimes when we Google, we get a lot of misinterpretation as well. And we end up doing this one thing that we didn't want to do.
Sure. Thank you. The red yeast rice I'm taking is both. It's combination of both CoQ10 and red yeast rice combined. So, yeah, I'm good. Thank you. Thanks.
Thank you, Ben.
Thank you.
I think Nicole had a question and you answered, right? No, let me just make sure. Yeah. So, Nicole, are you okay? Do you need more answer? Jasmine, can you read her question?
So Nicole said, thoughts on taking Armour thyroid, even though it's porcine derived. Many avoid it due to religious preferences. Do you think Armour thyroid is better than Synthroid, or worse to the switch and worth the switch? So this is actually a great question, because yes, for religious reasons, a lot of people don't like to take Armour because it's from a pig gland. Also, another reason a lot of people don't like to take it is because if you have an autoimmune condition, which you most likely do when you have hypothyroid, you most likely also have Hashimoto's. When you have an autoimmune condition and you're putting this extra a pig's gland, you have no idea how your body is going to react. So it's completely fair that someone will be hesitant to taking this in the first place. I use it in my practice. I like it, but I use it when I think it's necessary. There are also other options for someone who wants to go the natural way. And the compounding pharmacies actually make something very similar to Armour, but it's made out of vegetables. So that's also another option to consider. But sometimes, whether it's for cost or for just for health reasons, people prefer to take Armour. And that's why it's very dependent on the person, really. But I'm a fan of it in general. I like it. I prefer it to Synthroid because Armour is a combination product, basically. It acts on T3 and T4. Synthroid, the one that we are comparing it to, only will focus on T4. So it doesn't always, so some people have a hard time when they only take T4 to naturally convert it to T3. And that's why some people are better off taking both of them together and doing the Armour instead. And you can always switch over. There are ways to switch over so you're not stuck with one. And then, of course, then like pregnancy is an issue too, but that's not something that we're really talking about here. But it just really depends on you and what condition you have and how your body reacts, really. And then I have another question directed to me, and it said, what kind of herbs are you talking about, Dr. Jasmine? So there are a variety of herbs, so it really depends on which hormone I'm trying to support. So for the thyroid, I use various herbs that help to support our adrenals, which are responsible for our stress response. I use herbs that our ancestors have been using for years that actually work very similar to a medication, because if you think back to it, all medications were derived from herbs. Herbs were first, and then the pharmaceutical industry got these herbs and they made them into synthetic versions. And so everything's derived from an herb. So there's certain herbs that are specific to your thyroid. And then there's also nutrients like selenium, zinc, iodine, all these things that we need for our thyroid to function properly. For progesterone, there's also various herbs that are used. And for estrogen, also various herbs for as well as for testosterone. So it just really depends on which hormone you're trying to support. In general, I would say for sex hormones, and this is very, very general, this is not to support progesterone or estrogen specifically. This is to have a balance. To have a balance, I always support adrenals, and that's because your adrenals sit above your kidneys and they're responsible for creating your sex hormones. So estrogen, progesterone, testosterone. They're also responsible for creating your cortisol response. So your stress response that Afsoon was talking about earlier with cortisol and insulin. And cortisol is supposed to spike in the morning so that you wake up and you're ready for the day and you feel refreshed and you're happy to go. And it's supposed to go down at night and melatonin goes up and then you get good sleep. Adrenals are also responsible for your mineral corticoids, so your blood pressure response. So anytime you have any kind of stress in your life, which we all do, no matter what kind of stress it is, whether it's from the environment, an environmental stressor, or it's a relationship stressor, or any other stressor in your life, your adrenals are the ones that feel it the most. So the basic general thing that I always focus on is supporting your adrenals. And that I always do through herbs. And that's a variety of different herbs as well. I don't know, Afsoon, did you want to add anything to that, or Noushin?
No, I mean, I will ask Afsoon, but it's 6:27 and we said that we finish by 6:30. So we need to see if everybody wants to stay for another few minutes, or we can continue our talk. We can, the three of us can come up in another time and see if people are interested. We can go more into depth. And I can teach EFT the other time, doesn't matter. Or I can leave you my link on the chat. So whoever likes to go on my website or YouTube channel, they can find the EFT video and do it, and then we can do it in person next time. Just want to stay between the time limit that we said we will. And this is a very interesting subject everybody can relate to. And I know after we are done, tons of questions are going to come. So thank you, Nicole. I wish we could see your face. Okay, let's see if here, you can, let me go to my chat. So basically, you can go to my website, drnoushin.com. You go under videos and you look for EFT, which is Emotional Freedom Technique. Or you can go on my YouTube channel and see all my stuff under my name. Emotional is this. So this one you can do, or you can go to my YouTube channel under Noushin Nikfarjam and watch it. If you have any questions, you can send me a message Yeah, and I can go through with the whole thing with you if you like. So I just give the mic to Afsoon and see what else you want to add before we say goodbye.
I wanted to say thank you to Nicole for the very nice suggestion that, we just put all of the bios and as well as our social media in our invitation next time. But based on our name, you can go in. Let me just put my Instagram. If you can, Jasmine John as well, do that as, this is, let me see. Everything is on my website as well, which is this link. So, after that is something that we can. Let me see, just go to everyone, sorry. Okay, so this is my website. Everything is under the website as well. And again, thank you so much for your time, for joining us today. This is, as mentioned initially, it's just an introduction, and so many questions I'm sure is going to come up as we start thinking about the whole subject and the whole ideas. If there are any specific things that you want us to more zoom in, let us know. Any questions that you might have, submit to us so that we can address them next time. But this is wonderful that, we just start talking about all these things and start sharing knowledge on these so needed areas. Thank you.
And I just wanted to add, for anyone who has not done EFT, emotional freedom technique, I highly, highly encourage you to check out Noushin's website, because it's incredible, especially for people that have a hard time meditating or just relax. It's not like you just stare into the blank space and you're left with your thoughts. It's a whole other level of calming your mind and really embracing how you feel. So if you feel anxious or you feel irritable or you're upset at something, it really embraces that instead of trying to say, this is a bad thing, I shouldn't feel this way. And you just embrace who you are. And it's extremely helpful. And Noushin does an amazing job with it. And I really highly encourage you all to check it out. It's a lot of fun too, especially if you get into it and you just start tapping yourself in random places while you're waiting in line or you're in traffic. It's fantastic. So definitely check that out.
Thank you, Jasmine. Yeah, please do check that out. And any questions you have, please send it to on our website, or if you're friends with us on Instagram or Facebook, whatever, we'll be more than happy to answer you. Next time, I think we might have to go for 2 hours because of the questions that come up. But thank you so much for joining us, all of you.
Yes, thank you, everyone.
Thank you so much for all the
Thank you.
That's fantastic. Very nice. Thank you.
Thank you.
Thank you.
Thank you so much. Bye-bye.
Thank you. Bye-bye.
Have a good evening. All right.